PhilHealth mess. Board explanation sought. Who should be accountable for the mess at Philippine Health Insurance Corporation, PhilHealth? Without pointing a finger directly at them, Senator Panfilo Lacson said members of the PhilHealth board had a lot of explaining to do since their defective policies caused losses for the agency. Besides, Lacson said, the board also was largely in charge of fund transfers and the investigation of erring healthcare institutions and providers. In a text message on Friday, Lacson said the PhilHealth board has more explaining to do since the bleeding of their funds is largely due to defective policies, not to mention that the central office controls most of the fund transfers. Moreover, he pointed out that the board, with its quasijudicial powers, was in charge of investigating erring healthcare institutions and providers. Roque points to higher-ups Harry Roque, lawyer for two whistleblowers who exposed the scheme to claim payments for those dialysis sessions, said officials higher up the ladder should be held accountable. He said former PhilHealth chief Roy Ferrer was among those involved in allegedly questionable activities. In a Senate hearing this week, Ferrer and former board member Roberto Salvador Jr. tasked several regional vice presidents as part of a supposed mafia that helped hospitals defraud the agency. The Senate throws followed allegations that PhilHealth has been paying for bogus claims and upscaled cases, for illnesses that were reported to be worse than they actually were so as to charge a bigger amount in health insurance. Roque said one issue Ferrer had to answer for was restoring the accreditation of Child Care Incorporated, formerly Hospital of the Infant Jesus, after it was denied by PhilHealth Accreditation Committee. Increase in cataract cases. He said Child Care Incorporated had a questionable 365% increase in the number of cataract cases it had handled from 2014 to 2015. Roque also contended that PhilHealth's former regional vice president for the National Capital Region, Mas and Shirley Domingo, and present regional vice president for NCR Gilda Diaz, were among those who should be held accountable for the continued payments to Wellmed Dialysis Center despite reports of alleged fraudulent claims. Mas also failed to act on reports of fake PhilHealth receipts used to dupe overseas Filipino workers, he added. He also alleged that PhilHealth's legal sector failed to act promptly on the complaints against Wellmed. He tasked Senior Vice President for Legal Rodolfo del Rosario and Senior Manager of the Fact-Finding, Enforcement and Investigation Department Ernesto Barbado. Overpayments in the Inquirer's investigative reports in June on PhilHealth fraud, insiders estimated that as much as $154 billion went to overpayments and other fraudulent schemes from 2013 to 2018. They arrived at the amount by making computations based on the 2014 Audit Observation Memorandum of the Commission on Audit, COA, Northern Mindanao, which found that PhilHealth overpaid in 20% of all cases it has processed. International auditors, the firm, which could serve as an independent third-party auditor, has a global reputation for investigating medical insurance fraud, he said without identifying it. Morales noted that the audit also was intended to ensure that the people behind the fraud would be held accountable. The audit would go as far left square bracket as right square bracket as records are available, he added. Left square bracket the COA, right square bracket in the years prior issued and qualified opinions. In accounting terms, that's a seal of good housekeeping. If there's corruption going on, how come left square bracket the right square bracket COA did not find it? Well, for one, this might not be in their mandate since they are looking at efficiency, not corruption, he said. Reckless conclusion. Health Secretary Francisco Dupe III has said that the amount lost to fraud that PhilHealth insiders estimated was a reckless conclusion, but he acknowledged that the fraudulent practices of some hospitals and doctors wouldn't have prospered if there were no collusion with erring officials. Aside from Morales, only 2 other new members of the board were appointed by President Duterte after the PhilHealth scam was exposed. As of July this year, PhilHealth said it has filed 753 administrative cases against various healthcare providers for violating its rules and regulations. Another 921 cases are also set to be filed, while 6,138 complaints are ready for resolution by the prosecution department. Aside from filing cases, management is planning systemic reforms to prevent opportunities for future corruption, such as intensified identification of fraudulent providers, institutionalizing automated data analytics strategies, and strengthening and fast-tracking legal processes, PhilHealth said in a statement on Friday. Accomplishment records. He said he wanted to see accomplishment records of PhilHealth regional officials, as these would show what actions they had taken to deal with the problems in their areas. The records would show, for instance, which areas had an unusually high number of cases of pneumonia, which could indicate fraudulent claims, and what was done about this, he said. Thank you for watching. Please subscribe.